Introduction. Blood cancer or leukemia is in fact the cancer of the body blood-forming tissues that including the bone marrow and the lymphatic system. Leukemia can have to both adults as and children. In this disease the bone marrow produces unusual white blood cells. Symptoms. The symptoms of leukemia are type precise, that includes fever, fatigue and weakness, infections, weight loss, bleeding and bruising, nose bleeding, tiny red spots, sweating at night, and bone pain. Since the symptoms of blood cancer is similar to that of flu and other common illnesses, hence the patients might not be able to realize the severity of this terrible disease. Early visit to the doctor in this case is fruitful so that the doctor could do detailed diagnosis and determine the presence or absence of leukemia. Causes. Although the real causes of leukemia are not known, however, it is said that the genetic and environmental factors are well thought out as possible causes for the growth of leukemia. The unusual white blood cells troop out the healthy blood in the bone marrow prominent to the growth of leukemia. Acute leukemia, that is undeveloped blood cells; chronic leukemia, that is mature blood cells reproduce or gather slowly. Lymphocytic leukemia, that is leukemia that affects the lymphoid cells, and myelogenous leukemia, that is leukemia affects the myeloid cells. Risk factors. Certain factors cause the danger of leukemia: previous cancer treatment, genetic disorders, exposure to chemicals, smoking and case history of leukemia. It's found that therapy and radiation have generally caused the danger of leukemia. Genetic disorders like Down syndrome additionally cause hyperbolic risk of leukemia. Chemicals like benzene are thought about to reinforce the danger of leukemia. Smoking over an extended amount is taken into account to cause leukemia. Tests and identification. Anyone or all symptoms of leukemia might prompt the doctor to advise the patient for complete identification. First, the doctor makes a physical examination to verify leukemia. This includes observing the patient's skin, pale skin for leukemia, swelling of humor nodes and enlargement of the liver and spleen. Blood tests that reveal abnormal growth of white blood cells or platelets. The bone marrow take a look at reveals leukemia cells. For this procedure, a sample of the bone marrow is collected from the hip bone by employing a long and skinny needle. Treatments and medicines. The treatment and medicines prescribed for cancer depends on the stage of the disease. The four most common treatments for leukemia embody therapy, use of medicine in pill or injection kind. The biological medical aid treatments that facilitate the system to acknowledge and attack leukemia cells. Targeted medical aid, drugs that attack specific vulnerabilities. Radiation, X-rays and high-energy beams are used to kill the cancer cells. Stem cell transplant, the diseased bone marrow/stem cells are replaced by healthy bone marrow.